That was Megan Davis reporting there, and we're joined now in the studio by one of our resident GPs, Dr. Helen Wall. Morning, Helen.
Morning.
Surely anything that gets more smear tests done is a good thing.
Absolutely. I mean, we're looking all the time to try and improve our screening uptake for all screening programmes, cervical smears being one of those. We know that the cervical smear screening programme saves around about 5,000 lives a year, and that could be so much more higher if we could get increased uptake, because about 1 in 3 women currently don't come forwards on an average, and in London only 50% of women, I believe, come forwards for their screening test, so this could be huge.
And there are lots of reasons why women think they just don't want to go, aren't there? What are the sort of reasons that you hear about?
The reasons we hear about are embarrassment, because obviously you have to get semi-naked and have that procedure done on
national screening programmes.
The Welsh Government said the seen by the Petition Committee at a later date.
That was Megan Davis reporting there, and we're joined now in the studio by one of our resident GPs, Dr. Helen Wall. Morning, Helen.
Morning.
Surely anything that gets more smear tests done is a good thing.
Absolutely. I mean, we're looking all the time to try and improve our screening uptake for all screening programmes, cervical smears being one of those. We know that the cervical smear screening programme saves around about 5,000 lives a year, and that could be so much more higher if we could get increased uptake, because about 1 in 3 women currently don't come forwards on an average, and in London only 50% of women, I believe, come forwards for their screening test, so this could be huge.
And there are lots of reasons why women think they just don't want to go, aren't there? What are the sort of reasons that you hear about?
The reasons we hear about are embarrassment, because obviously you have to get semi-naked and have that procedure done. Fear, not really knowing what to expect, particularly for women who it's their first smear, not knowing what's going to happen, what to expect with that. Is it going to be uncomfortable? Are they going to be embarrassed? Is it going to be a male taking the smear? Is it going to be a woman taking the smear? You know, the unknown, the fear of the unknown, and also there's some cultural barriers there as well. You know, culturally it may not be an accepted test, so there's lots of barriers there, but also we can't forget about the convenience aspects of this. With everything that we do with screening, there's a convenience element, and our lives are much busier than they once were, and we're facing a cost of living crisis. People can't take time off work, they can't afford childcare, they have no one to leave the children with. So there's lots of practical reasons as well why women may not be coming forwards for that smear.
But how reliable are the at-home versions of the screening? Well,
this is all still up for debate, isn't it? And there's a few pilots and research tests being carried out since 2021 on this, one called the HPV Validate test, which is looking at women taking their own sample and then having the sample taken again once in a clinic and looking at how reliable that is. And all of that will be brought in under the UK National Screening Committee and decided whether it's a valid test that could be done at home.
And is maybe age a factor as well? You know, you talk about women who haven't even been for their first smear test. You would imagine that most younger women would be better having somebody else do that for them.
Yeah, I think it's a fairly simple thing to do. You know, it's a swab test at the end of the day, so I think it will be fairly simple. As it said on the VT there, we're going to have to educate women how to do this test. I think one thing that strikes me is, although women can do this HPV test at home, what happens in a normal smear test is you have a smear test done, the lab test it for HPV, which is the virus which we think causes the majority of cervical cancers, and then they look at the cells if you're positive for that. So it will still involve women then coming forwards for further tests. It's not a case of, doing the test at home will not tell you one way or another whether you have cancer. It will tell you, like all screening tests, whether you're high risk for that cancer, and then you'll have to go on and have further testing. So it will narrow the number of women down that have to come into clinics, but it won't completely eradicate the use of clinics and further testing.
So I suppose it's really important that if this is the way forward, the communication between the NHS and the patient is really clear, so that you get your results explained to you and analysed and communicated properly.
I'm a big believer in communication being a key thing that we struggle with, to do effectively all the time with patients, and it causes an untold amount of anxiety and fear. And fear of the unknown means that people don't come forward for screening tests and don't come forward for other interventions that we need to do to protect them and save lives. So I think communication is always a key factor here.
We've also been talking this morning on the programme about weight loss apps and how 4 particular apps are being looked at the moment, possibly going to be taken on for a kind of a formal use. They would have the ability to prescribe weight loss injections, which we talk about a lot at the moment. What do you think about that? How in demand are weight loss services in the NHS?
Obesity is very fast becoming our next pandemic, isn't it? You know, lots and lots of people are struggling with obesity, and it is, you know, deemed an illness in itself, really. I think it's very glib of healthcare professionals sometimes to say, well, you just need to eat less or move more. You know, it's a very difficult thing for people to do, particularly with all the other pressures in our current society. It doesn't work for everybody. I think the key with these apps is there's a lot to it, not just the weight loss. You know, everybody's focusing in on the weight loss drug being able to be prescribed. They have their place. They've been shown to be very effective, but there's a lot more to these apps. And if you look at the pilots that have already been done with the apps, people who engaged with them and carried on with them for at least 12 weeks actually all lost weight, by and large. The problem is that people drop out of it, so they might download the app, start it, and then not stick to it. So I think it's about the psychology, the nutrition, the dietary advice, the psychological support, and then the drugs is a separate thing that will be available there as well.
I guess both these stories come together, don't they? It's about how we can use technology.
Yeah, it's about using technology to help us with that demand, because demand has just soared, you know, since the pandemic. We've got an ageing population, we've got an increasing population. You know, we are going to have to start to look at new ways, innovative ways to, you know, to get around this demand. And a lot of areas don't have obesity services, so this would be a welcome thing for most people.
OK, Helen, thank you very much indeed. Good to see you as ever.
Coming up here on the programme.